Hello there, and a warm welcome to this EMIC webinar. My name is Fiona Costello, and it's my great pleasure to be your host for today's session. A bit about me: I'm currently Business Development Director at Air Innovate, with coming on to 17 years' experience in healthcare, including the UK's NHS, private organisations, non-profits, and international projects. In recent years, I've been involved in a number of digital health initiatives. At Silver Cloud Health, I helped to expand digital mental health technology within NHS services during COVID. And later at Orca, the Organisation for the Review of Care and Health Apps, I worked on a range of digital health app assessment projects, including those specifically focused on mental health. It was those projects that led me to this wonderful community facilitated by EMIC and to be moderating what is for me this evening's webinar, but wherever you are in the world, a very warm welcome to you. Today, we're going to be talking about a really important topic: harnessing AI symptom tracking to advance measurement-based care. You will all know that over the past year and a half, in particular, AI discussions have surged, driven by advancements in generative AI technologies like ChatGPT. However, AI's impact on mental health in particular has been evolving for much longer, offering new ways to diagnose, treat, and manage conditions. In 2024, AI is expected to move from experimental phases to real-world applications, significantly reducing administrative burdens and enhancing clinical decision-making. So it's with that in mind that our esteemed panelists from Core Solutions will draw on their expertise in behavioral health and artificial intelligence to explain how they are addressing current mental health challenges by implementing technological advancements to ensure measurement-based care becomes a reality for all. You'll hear from our speakers very shortly, but first I have a few quick points to mention. First and foremost, feel free to share your current location or areas of interest. To do so, you can click on the three dots next to your name tag, choose Edit, and add your country or area. This will allow you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the chat box. I know that there have been a couple already. During the Q&A session, I will do my best to include as many of them as possible in our discussion, because we really want to put your questions across. And lastly, today's webinar is being recorded, and the EMIC team will soon share the recording in the knowledge bank for you to refer to. So now it gives me great pleasure to briefly introduce our first speaker, Ravi Ganasam. Ravi is the founder and CEO of Core Solutions, where he leads the revolution in behavioral health through artificial intelligence and other cutting-edge technologies. With over 25 years of dedication, Ravi has addressed the unique challenges of the health and human services industry by developing innovative EHR technology, significantly improving treatment outcomes. His deep expertise in healthcare and technology, combined with a strong commitment to customer satisfaction, has established Core Solutions as a leading software provider nationwide. As CEO, Ravi has successfully established partnerships with large providers, government agencies, and leading management consulting firms to improve treatment for behavioral health and intellectual and developmental disability services. Ravi is an active speaker on AI and data-driven decision-making. Ravi received his MBA from St. Joseph's University in Philadelphia. So without further ado, if I can welcome Ravi to now present.
Thank you, Fiona. Thank you for that kind introduction. I'm going to share my screen. So hello, everyone, and welcome to our webinar. Whether it's morning, afternoon, or evening, wherever you are, we are really glad you could join us today. And today we'll be talking about AI's role in mental health. First I have to tell you that we are really all very fortunate to be living at this present moment. We are witnessing firsthand the introduction of probably the most powerful technology we have seen in a century or more than a century. A technology which has the power to transform how we live, how we work. If you don't believe me for a second, just think about the introduction of smartphones 15 years ago. Within a decade, we have become so dependent on our smartphones. We cannot imagine how we managed to do things before the smartphone. And if you think about it, how many of you would be able to take a paper map, to navigate, drive from one location to another? We all use our smartphones. So we have come to accept a new way of doing with using smartphones. AI is very different from your smartphone. AI will have 100 times more impact than the smartphone, and it will have that impact in a much shorter time. AI is not just going to be embedded in your phone, it'll be in everything that you see, everything you touch. So let's embrace this change. Let's see how we can use this powerful technology to improve lives. AI is going to address several areas of mental health. It'll help us to improve access to treatment. It'll help create new efficiencies that will help reduce costs. It'll support integration with other areas of healthcare. But what we are here to talk about today is how can AI improve clinical care? More specifically, we'll explore how AI can help with timely and accurate diagnosis for mental health conditions. So we'll start with the definition of diagnostic error. So what is diagnostic error? Diagnostic error is the failure to establish an accurate and timely explanation of the patient or the consumer's health problems and communicate that explanation to the patient. My apologies. Okay. So let's look at a couple of studies. In the first example, a study of children and adolescents, it was found 18% of anxiety disorder diagnoses were missed by clinicians. Similarly, 29% of major depressive disorders were misdiagnosed. And in fact, they were anxiety disorders. There's another study from Canada where 61% of adults reported receiving their diagnosis after 1 year of onset. And that study further, found that 31% of individuals took 5 years or more from the onset of their symptoms to get a diagnosis. Think about this for a minute. If you were to go to your cardiologist knowing that, over 30% of the time they're wrong, that's not going to really make you feel any better. And what is the impact to the system? The number of visits the individual has to make, potentially the different medications they have to go through. And most importantly, think about the impact on the consumer or the patient. So my question to you is this: can we do better than this? Do we want to do better than this? And for probably everyone in this meeting, the answer is a profound yes. Because for a long time, we have come to accept that treatment for mental health is trial and error. With AI, we have an opportunity to address this problem. And we really believe this is an important problem that is worth solving. I think our consumers deserve better. So that's the problem that we're going to focus on today. Now, with everything I've said, this is not to imply treatment for mental health is easy. So, unlike a lot of other diagnoses in healthcare, diagnosis for mental health is a lot more complex. One, it's subjective. There are no lab tests, for identifying mental health conditions. The symptoms are self-reported, which means it's what the consumer or the patient is reporting back to the clinician. And we all know that, this is a very subjective process that varies greatly across the different consumers that we serve. And if you think about it, what one person might think of as being sad could be very different than someone else's definition. So it's really a subjective process. The second challenge is oftentimes symptoms for mental health conditions overlap. They could overlap with other mental health conditions or physical health conditions. And this makes diagnosis really a challenge. Another big challenge is how symptoms vary from one session to another. That could be just a person could be having a bad day. Something could have happened at work or home, and the symptoms that the individual is reporting are just a little different today. So the symptom variability, my apologies, is something that makes diagnosis a big challenge. And last but not least, cultural barriers. There are some cultures that are very expressive, and other cultures where people do not want to talk about some of these problems. So all of this makes actually diagnosing mental health conditions a big challenge. So what is AI going to do? How is AI going to help, address this problem? There are two aspects of AI that really come together to help solve this problem. The first piece is AI's natural language processing capabilities. Most of us use smartphones, smart devices, and we often talk to, whether it's Google, Alexa, or, Siri, we say, create an appointment, send a text. We ask our, digital assistants to do a lot of different tasks. If you think about it, the ability of that device to do that is based on natural language processing. The device has to understand what the person is asking. It has to interpret that, potentially manipulate that. And if it does not understand something, it's going to ask for a clarification. So in effect, natural language processing allows AI to have a communication. Now, the second piece that comes together is this idea of a large language model. So what is a large language model? One way to think about it is think about it as an encyclopedia. It has a lot of knowledge, information that is stored within the model. And these models have become, larger and larger. Today's models, the model that we use, is trained on 110 trillion words. I want you to think about trillions of words that are going into training a model. Now you compare that with an average human being, an adult. An average adult probably knows about 30,000 words. So AI, is pretty powerful when you put these things together. And the thing about AI is it's constantly learning with more data. So I'm going to give you an example. Let's say a clinician has written a statement that says, client is expressing feeling sad and lonely for the past 5 days. Client's mother has a history of depression and anxiety. Let's say, how will AI look at these statements and try to interpret this? AI will first identify what we call entities. Who are we talking about? Is it an individual? Is it a company? And in this case, the client is the entity that we are talking about. And what we have done with our language model is trained our model and all the different mental health, substance use, conditions and social determinants of health. We have trained our model to understand that feeling sad is a symptom. It could be a symptom of depression, anxiety, many things, but it is a symptom. The other thing that natural language processing would allow us to do is to look at, for example, past 5 days. We are looking at it through a time frame. So AI can identify that. Now, it's also important for AI to understand the context. For example, if, in the clinical note, it says client's mother has a history of depression, AI should not confuse that with the individual we are talking about. So AI has the ability to understand the context of the statement. So putting these things together, we have created an algorithm that can look at either listen to conversations, look at unstructured data, and identify symptoms. So later in this presentation, we are going to demonstrate how this works. So let's say we have actually addressed the first issue, which is really using the AI to identify symptoms and diagnosis. Now comes the next challenge, measurement-based care. And there are multiple studies that suggest there is a gap in perception between the clinician and the patient. In this particular study, it found that therapists believed 85% of their patients improved, but the research suggestion was probably the improvement was between 40 to 60%. It also discovered that clinicians often feel that their patients have not deteriorated, but oftentimes the individuals receiving services have deteriorated during therapy. So how do we solve this? If we can start measuring things, I think we can actually quantify and be able to say, is the individual getting better with treatment? And this idea that, there is a famous quote that says, what cannot be measured cannot be improved. And we probably do this in our own lives. For a lot of people who want to, feel well, get better, improve their health, we oftentimes count the number of steps. And why is that important? Because we know, are we making progress? And imagine the feeling when you achieve that goal, you just feel like 10,000 steps. I have done something amazing today. You feel good. You feel better. I think the individuals who receive mental health treatment and services deserve the same. And there is a saying that belief in recovery is as important as recovery. So when individuals are able to see the results and the progress for themselves with measurement-based care, recovery happens. So this is something that I think AI can really help. How is AI going to help? So one of the most common tools used across the world is PHQ-9. And PHQ-9 has a set of 9 questions that looks at different feelings the individual has had over a period of 2 weeks. Now, typically this is done by the clinician or by the individual receiving services, and then a score is arrived. But with AI and the clinical conversation or the notes, we are able to arrive at the same score. And I'll tell you how this works in a minute. So let's say there is a note, and the note has client has had little interest or pleasure in doing things over the past few days. AI can start looking at these words and say, over the past few days means several days in the PHQ-9 scale. So then it can assign a score of 1. Maybe if the statement said, over the past few weeks, over the last 8 weeks or several weeks, there are different ways conversations happen. But we train our models to look for, what is that in the conversation? Is the individual talking about days, weeks, and then quantifying that to say, is it several days, more than half the days, or nearly every day? So we are again using natural language processing and the ability to look for, a sequence of words, again, taking into account the context and all of the things, to quantify this and to use this information to, complete the PHQ-9 and provide a score. Doing all of this without any additional work on the clinician. So going back to the idea, what can AI do for us? AI, gives us the opportunity to democratize treatment for mental health. So these are powerful tools. And I'm going to turn this over to Mike Laudieri, who's going to actually demonstrate how some of these concepts work. So Fiona.
Thank you so much, Ravi. You've given me a lot of sound bites actually there. I think I was really struck by some of the things you said, particularly what cannot be measured cannot be improved. I think that's so powerful in the world that we work in, particularly when we're thinking about people and their outcomes and their health and well-being. So now I'm delighted to introduce our second speaker, Mike Laudieri, is a licensed clinical social worker with a 30+ year history leading behavioral health organizations. He has led some of the largest behavioral health organizations in the nation, including for-profit, not-for-profit, and managed care organizations. Mike is an expert in 42 CFR Part 2 and the implementation of artificial intelligence and machine learning in behavioral health settings. He is also a national leader in quality measurement and sits on the Battelle Partnership for Quality Management Committee. He has also held senior leadership positions at the National Association for Community Health Centres, Northwell Health, the largest provider in NY State, and the National Council for Mental Wellbeing. And he is also joining us from his holidays in Portugal. So without further ado, Mike, thank you very much. We're really looking forward to hearing what you've got to say.
Great. Thanks, Fiona. Thanks. I appreciate the nice introduction. And hello, everyone from wherever you are across the world. So welcome. Bear with me 1 second while I share my screen. And start from, let's show. Oh, I'm sorry. And I tried to do it right so I could start right from where I was. So. Yeah. 1 second. One more. There we go. So we'll talk a little bit about how AI can help us when we're treating our clients, consumers, patients, individuals, depending on where you are. We call people different things in behavioral health, but they're all the people that we serve. So we think, and I believe that the notes that providers write are really a rich repository of information. When you look across caregivers, a peer may write something a little different than a nurse or versus a social worker versus a psychologist. So everybody's writing, notating something on the client. They all have their own vision of that. And then you also have information from the client or the consumer who may add to the electronic record. We would all love to be able to review the client's record, maybe go back 3 months to prepare ourselves for the session with the client. But knowing how busy everybody is, and it's not just being busy, it's that, we have workforce issues, across all countries, and we don't have enough workforce to actually do that. Nobody has the actual time to do that. So what symptom tracking enables an organization to do is really review unstructured data across the system, identify changes in symptoms, assist with ongoing differential diagnosis, assist with treat to target initiatives. So I want to treat to the target symptoms that the client is having now, and identify clients that need services, and we want to be proactive. We don't want to wait. We want to try to find those early on. So the unstructured data in the clinical notes really gives us a glimpse into the physicians or the providers, the caregiver's brain and what they're thinking. And written notes often capture the severity of a client's health condition or nuanced non-clinical social needs far better than highly structured diagnostic codes. Clinical and administrative staff can easily parse that text and look at a session. The problem comes into when you want to look at sessions that go 6 months back, or you want to look across your entire population over a specific period of time. That takes a lot of workforce energy to do that. And we can apply AI to this kind of activity to really help move things forward. And it's important to recognize that the storage requirements, when you begin to look at this, it's just not a few rows of data. There's thousands, tens of thousands, sometimes hundreds of thousands of lines of information that you need to go through. So we know that studies have identified that the promise and difficulties with pooling, and in different countries use different words for either social determinants of health or really health-related social needs. So in the US, we're still in social determinants of health, but we talk about health-related social needs. And so to symptom tracking, how does this work? What we've done is we have unpacked the ICD-10. We've broken down all those diagnoses into symptoms. And here you can see some of the top 10 symptoms, diagnoses. They have a lot of different symptom or symptom segments, we call them, that we've pulled out. So it's not easy to coalesce all this stuff when you're in a session. And I'm going to go through that in a little bit. We'll also talk about, we can do this on a mobile app, track home visits, get a client profile, and everything I'm going to show you is also available within an app structure. So we'll talk about ambient clinical documentation, and we'll show you how that works. I mean, this is where you're actually capturing the discussion between the client and the clinician or the peer or whoever's interacting with the client. Or you could do that through dictation. We're going to show you how you do symptom and diagnosis tracking. And then we're going to talk a little about evidence-based practice just briefly. So now I'm going to switch screens, if you will. And I'm going to show, hopefully you're seeing a screen now which says notes, clinician. What I'm going to paste in here, and if you can't see it, somebody should yell to me. So what I've pasted in here is a note. This is not an AI generated note, it's a clinical note. So if you look at it briefly, you'll see that it expresses what a note might express when you first see a client, or you see a client that hasn't been seen for a while. What you'll notice is some stuff in red and some things in blue. I highlighted those specifically to pull out some of those issues in red are clinical symptoms. The stuff in blue is health-related social needs. So we know that we need to capture both when we're talking to a client. And I'm a social worker, so my training is to look at the client holistically. And if I know that they can't afford food, well, it's going to be very difficult for me to have them pay for their medicine when they're trying to pay for their food. So we need to do something to help them along. So what I'm going to do, imagine that at some point, whether I dictated this, whether I captured it from a summary, it needs to get to this point that it's a note that the clinician has said, yep, this is the note I want to use. So what we do is before you submit the note, what we're going to do is process that note. And right now you see the note is processing. And as soon as it's done doing that, it takes about 25, 30 seconds to do the processing, because it's going back, it's looking at a lot of data, it's pulling all that data forward and giving us a glimpse into what's happening with the client. So what you see, we just pulled up those symptoms, but what's more important, I'll go back to that slide. What's more important is where we want to be right now, clinical decision support at the point of care. What does this do? What is this showing us? Right now, this is showing us in that note, symptoms for generalized anxiety disorder, caffeine withdrawal, tobacco withdrawal, and all the different symptoms that across a number of different disorders. And you can see the health-related social needs issues are identified as well. So why is this important? Well, it's important to me as a clinician because this helps me now coalesce all the data that is in that note that, it takes me a lot of brain power to do that, or the clinician a lot of brain power to do that. And if you're not a clinician, you're not even going to get to this part because you're not necessarily thinking about diagnosis because you haven't been trained in that. But when you look at this, what comes to my mind as a clinician is, you know what? The main symptoms are generalized anxiety disorder, but I'm looking at tobacco withdrawal and caffeine withdrawal as well. I didn't ask the client about that in this session. I got to go back and ask the client about that, because if they just stop drinking, smoking tobacco, or just stop drinking coffee just recently, well, my whole treatment plan around the generalized anxiety disorder is going to be much different, because I'm going to deal with this first in a short-term capacity, versus sending the client to possibly get evaluated for medication for anxiety disorder. So right at the point of care, this helps me make those clinical decisions. If you go back to the symptoms, now you can see where that data was pulled from, right? So you look at the chart, you can see there's different things here. And what happens, so anxiety disorder is really connected with 7 different diagnoses. We also picked up the contact with and suspected exposure to lead, a big deal. And in some communities, it's worse than others. So we're able to pull that. That's a health-related social needs that we're able to pull. Same as the lack of food and exposure to lead down there. So that helps. And then we also look at our health-related social needs. In the US, we have a specific form that we complete for health-related social needs and many value-based payment arrangements. So we can automatically complete that form. And then what we're also able to do is look at the PHQ-9. Ravi mentioned that. So for this particular session, these are what's the issues that popped up from the PHQ-9. But we know the PHQ-9 is in a single instance. So what we're able to do, we're able to take this, look at it over time. And when we look at it over time, things look like this. So imagine, in a different setting, I would show you this. Because when I come in as a clinician, the first thing I want to see is what's happening with the client. So, going back that 30, 60, 90 days that I spoke about earlier, I don't have to go back. Right now, if I pull this up first, now I can see what's happening with the client over time. They started with generalized anxiety disorder and major depressive disorder. We did pretty well with the major depressive disorder, you can see that. But on the anxiety disorder, the patient's really been struggling with that. They had some decrease, but right now, today, when I'm seeing the client, hey, they're struggling with anxiety disorder. I better do something about that. So now I'm prepared to actually go in and talk to the client. So the usual progression would be first, come in, let's look at the diagnosis and trending, talk to the client. Then we look at, evaluating that session and that note, and using that clinical decision support, and then moving forward. And then the next step in the process is, once we've identified the diagnosis or the symptoms that we want to work on, hopefully we're going to want to use an evidence-based practice. Now, what I'm going to show you here is not really part of AI, but it's really comes out, and you want to follow up with an evidence-based practice. If your AI is able to tell you that this client is trending towards a certain diagnosis, well, then I want to use an evidence-based practice that's targeted to that diagnosis. So what we do, we allow this little window to pop up and pop out. And so we have a little side panel we bring up for the clinician or the staff person. And if they're going to start an evidence-based practice, we give you the evidence-based practice. We give you the steps, right? And this is a real clinical CBT for depression. This is the evidence-based practice that we built in our platform. And you can see that every session is different. But more important, it just gives you, the clinician, the practitioner, the ability to just go through the evidence-based practice. I'm a clinician, and I've done evidence-based practice, and I've always struggled with, on the one side of my brain, I don't have the book in front of me when I'm doing the evidence-based practice. So the one side of my brain, I'm trying to say, what do I need for the evidence-based practice? The other side of my brain, I'm really trying to have a relationship with this client and help them through whatever struggles they're dealing with. So, what we do, which is a little different than other vendors, we give you the evidence-based practice up front. There's a workflow engine behind this that drives that. All you need to do is check off what you're doing, and then you have that as your documentation later on. But more importantly, that little workflow engine really drives other things behind. So in this particular situation, in this evidence-based practice, you're supposed to get a PHQ-9 and a GAD-7 back 2 days before the next session. What the platform or the system does, it sends that out to the client 2 days before. If it doesn't come back 2 days before, it sends it out the day before. If it doesn't come back, it sends out the day up. More importantly, is that when it does come back, we notify the clinician that it did come back. Now the clinician can go and look at it before they see the client and be prepared. So that's how this all comes together. We use the AI to help us formulate what the diagnostic picture is like. We use the clinical decision support at the point of care to really refine it even more. And then once we have that refinement, then we move over to evidence-based practice. So hopefully that gives you some of a feel of how this whole AI can really help and move us forward and really help to improve the population. And when I think of this, it's beyond just the individual client, because we want to apply this across our whole population. So hopefully that'll give you a good idea of what the capabilities are. And Fiona, back
Thank
to
you
you.
so much. Thank you so much, Mike. Ravi, we'd love for you to be able to join us again here so that we can answer some questions. I think what you've presented, just waiting for Ravi. Hi, Ravi. What you've presented is really interesting. We could probably take the conversation off in a few different directions, but I think, Ravi, first and foremost, I'd really like to understand, how do you envision the future of mental health care, and what role do you see AI playing in shaping this future, and particularly with regards to both workforce engagement and buy-in, but also the engagement of your consumer or your patient or your client, whatever name we give to them, but how they come to understand this technology and how they come to trust in the power of this technology.
Thank you, Fiona. I think that's a good place to start setting the stage. I'm going to read something that inspires me. And this is a goal that the Kennedy Forum has set. By 2023, 90% of all individuals will be screened for mental health and substance use disorders. 90% of those screened will be able to receive evidence-based treatment. 90% of those receiving treatment will be able to manage their symptoms and recovery. 90, 90, 90, and we have 9 years. And this is a pretty ambitious goal, but an inspiring goal. Now, to achieve a goal like this, I think the traditional ways of doing business will not help us, get here. So AI can play a big role in achieving an ambitious goal like this. So, what can we achieve not in the next 6 months, 12 months, but what can we achieve in the next decade? I think we can achieve a goal like this. Now, how is AI going to fit into this goal? The first part of really having this ambitious goal is we need to be able to screen individuals, identify symptoms and diagnoses. And what we talked about today is a step in that direction. The technology that we shared is going to allow and make it easier to identify the right mental health diagnosis, faster than what we are doing today. Once that is done, we need to be able to identify the right evidence-based practices to help in the treatment process, the recovery process. And that's the second 90%. By integrating evidence-based practice into this AI stream,
we are able to then integrate, what happens. And I want you to think about this for a minute. I think you are in England. And if I am traveling in England and I happen to have chest pain and I go to any of the hospitals there, the standard of care is exactly the same as any hospital in any part of the United States or most parts of the world. But if I go to, England and I'm depressed and I go to a hospital, I don't know what to expect because we don't have standards of care. That's the other piece with AI that, we are all working towards. So we want to be able to connect these dots, identifying the right symptoms and diagnoses, connecting that with the right treatment protocols, and creating standards of care so we have a consistent way of helping people recover. And the last piece of this is consumer engagement. The technology that Mike shared is also available for the consumer in a consumer diary, in a consumer portal, where they can talk about their feelings and emotions and get feedback. And I think that's the future. That's the future. I'm just thinking of this app, Duolingo. And, for people who have used it, you can talk to the app and it's going to give you feedback. Is there a time 10 years from now where I'm talking into a patient diary, a consumer diary, and it's giving me feedback to say, Ravi, you've made great progress towards your anxiety disorder. You've had an 87% improvement in your score. I think that's the future. But it's a destination and we are on a journey where I'd say we are in the early parts of the journey, but that's the future. So hopefully that gives you, I think, our view on this topic.
Yeah, no, it's amazing. I think what you've described is kind of, there is so much short-term thinking in healthcare because of the challenges, these really significant systemic challenges that we face, demand, capacity, workforce, and to be able to use tools to potentially create that runway is a really interesting take and a really interesting point. Mike, if I can just go to you for a moment. When we think about workforce, obviously we know that across the world, workforce has been identified as one of the biggest challenges facing healthcare delivery in the world today. How do you think AI can assist with burnout and other staffing issues in mental health care? And if so, how might it alleviate these challenges?
Yeah, that's a great question, Fiona. So there are a couple of different ways that that'll happen. Well, Robbie identified one. So he talked about a client portal or a consumer portal. One way is to have people journaling and for us to review that journaling and then pick up those people who need assistance and pinpoint them and reach out. And that in itself is saving a huge amount of person hours to do that mining of that data, right? So that takes some level of effort away from the workforce. The other thing that I think is very important is what I showed earlier. Most clinicians, clinical people, anybody who's dealing with the client, they want to know what they're dealing with before they go in to see that client, right? And if you don't have the time to go back in the chart, you're sort of like flying by the seat of your pants, which is no good for anybody, especially in healthcare. So by having that symptom tracking in front of you, that just cut out a lot of other time and anxiety for the clinician. The other piece that comes into play is just the task of taking the note writing task away from the clinician so that they can still write their note or dictate their note, but it's not taking 20 minutes. The note that I pasted in there that you saw, it's really a 2-minute dictation, right? So to do that in 2 minutes versus, I know if I was writing that by hand, it's going to take me 15 or 20 minutes. Some studies have shown that using that functionality really cuts to 30 to 50% of a clinician's documentation time. So if you imagine you have all that time now to do something else, maybe to spend more time with some of the clients that are more distressed or higher acuity, or maybe do some other work within the organization that's important. So freeing up the clinician to really spend their time doing clinical work is really the benefit that I see with the AI as we move forward.
Yeah, and as you were talking, I think as well the experience of the client in the consultation and that feeling heard and feeling like it's a conversation, quite often in the UK, feeling like basically you're talking to someone who's just on their computer the whole time. So to be able to kind of release some of that efficiency and then to be able to have that really meaningful conversation, meeting someone where they are, I think is also possibly another tangent from what you've just described. I'm really conscious of time, and therefore I'm going to go straight to the questions because we've got a number of questions in the chat and then we can circle back. So if you bear with me, so first and foremost from Jeanette. Hello, Jeanette. Any experience using this technology with call recordings? We do a lot of telehealth, mental health, and record our calls.
So
Oh, absolutely. Yeah, go ahead, Bobby. Yep.
So the technology that we offer is based on, in technical terms, something called APIs. So they can be used with any system. It's not something that's embedded into our software particularly or in our mobile app. So in fact, we had a call with someone yesterday who is actually looking at how do we integrate this with the 998 system. So as these calls are happening, we can provide feedback because oftentimes the individuals receiving these calls are not really, as well trained or the experience to look at all the kinds of things that could be happening with the individual. So this is an excellent use case where AI can provide immediate feedback and escalate the call depending on the findings. So again, the technology-wise, it's an API that can be easily integrated. Mike, you can add on the clinical side anything else that you think is relevant.
Yeah. So I lost the question, so I was following you. So you want to get me back on track?
So the question was, any experience using this technology with call recordings? We do a lot of telehealth, mental health, and record our calls.
Okay. So where I was going, what I was thinking when I started talking was, if you take your recordings and we use your recordings and look at it from a population health standpoint, once we take those recordings, we can do the same thing that you saw that I did on the screen, except apply it to your whole population, right? And when you do that, then you're going to be able to see which clients bubble up having more acuity just from that conversation that, if they were having a conversation with a non-clinical person, it may not click, but when you then look at it over time, now we're able to evaluate it and use the AI to help to bubble up those people who are in more need. So that's how I see it being used.
Thank you so much, Mike.
Sorry, that's
So no, I think this is possibly a question for you, Mike, first and foremost, but there's a really interesting question. How does this work with the movement of a number of psychiatrists around the world suggesting that diagnosing is not actually helpful, that we have been getting it wrong doing that?
I don't know that we're saying they're getting it wrong. I think what we're saying is it's not as fast and as helpful as it could be. So we have we can only use the information we get. And if we're not getting as deep information as we can, well, then we don't have the benefit of making the diagnosis as accurate as we can. Because, when you're doing a diagnosis, you're looking at symptoms which cross, as you saw on those symptoms chart, certain symptoms cross like 10 different diagnoses. So the whole art of being a clinician is taking those symptoms and then deciding that, oh, these are the cluster of symptoms over what period of time. It's a difficult thing to do. So I wouldn't say it's wrong. I would say that working on more limited information. Now, if we expand the information that's available to the clinician, that just gives them more tools to help to make even a better diagnosis. And are we ever going to be perfect? The AI is not going to be perfect. It's going to help us, though, as a tool. These things are tools. It's going to help us as a tool to get better and then serve the people we serve better.
Thank you. And there was another question that was a follow-on to that saying, and how does it incorporate practice-based evidence before it becomes evidence-based practice?
Well, in terms of, you can train the model to identify that that practice-based medicine and lead you towards the goal of evidence-based practice. And I think what we'll see is that AI will actually accelerate. It's not going to take us 17 years anymore to get something into evidence-based practice. The AI really accelerate that and move things from practice-based medicine to then evidence-based practice. It'll just be a much faster pace.
Yeah. So there's another question here. You mentioned the app. From a health information management perspective, what specific security measures and encryption protocols are in place to ensure that PHI, protected health information, remains secure and storage when integrating AI? How does an organization to ensure ongoing compliance with HIPAA privacy and security rules?
Now, there are many aspects to that question, but at minimum, the first thing that you look for when looking at health information in AI is AI is the data leaving, the perimeter of where data is stored. For example, if you're using ChatGPT or OpenAI, then the data is moving from your environment to OpenAI for processing. All of the work that we do is within our AWS environment. Amazon Web Services is where we do all the processing of data. So at no point in time does data leave that environment. We have also, gone through various kinds of certifications like NIST 853, where there are comprehensive safeguards that are built into data encryption, data storage, who accesses data. Data is encrypted at rest, for example. Access is restricted in terms of who has access to the environments. So there are a lot of safeguards built in, but if someone is looking at AI and thinking, can ChatGPT do this? Can I do this in OpenAI? The answer is you might be able to cut and paste a note and ask for it to do certain things, but that puts information at risk. What we have created is a very secure way where data does not leave the environment where it is stored. And happy to spend more time, but that there are a lot of complexities and safeguards built into data protection.
Yeah, there is actually a follow-on. Sorry, Mike, go on.
No, I just had to add to that things are changing so rapidly that we generally think of AI, like Ravi's explaining, as being out in the whole internet. Not like that anymore. Now I can bring my own AI box, if you will, into a separate environment. All the information never leaves that. Now we're much more secure than you think. It's just out in the world.
And I think this comes back to the previous point, which is about education and engagement with AI and these different types of AI and how information is sourced and extracted and then used to power some of these algorithms and so on. There is another question just relating to information governance. How do we know these programs are HIPAA compliant as well as SOC 2 certified other than verbally confirmed? The internet uses SSL and uses the lock icon. Is there something like this to ensure compliance?
Well, again, there are different ways of accessing the AI. You can access the AI through an API that we can provide. You can access the API through a mobile app. So each of those access points have different safeguards built in. But we go through external certification, external vendors that look at our processes, because it's partly technology, but the bigger part is governance. Technical safeguards are important. So we have annual audits with external third parties that look at, it's everything that we do in terms of information security management. So that's how we can say that our processes meet, the best standards, which is NIST 853. NIST 853 is sort of on a more stringent process than SOC 2. So it has everything in SOC 2, plus it has a lot of additional controls. Around AI, NIST has more of a new AI framework that we are evaluating, and we are going to be, as certifications become more a standard, and there are companies that are willing to go through that in terms of test, verify, we will continue to expand our security program. But we go through external audits. That's how we know, it's not just Mike or I saying we do something, that there's someone from outside coming in and looking into our house and saying, give me the evidence, show me, how you do this, when you did this, and I will tell you if you're doing it or not.
Mike, were you going to come in then?
No, I think Ravi covered it, but in the US, it's important to understand that certified EHRs, which we are one, are governed by the Office of the National Coordinator. And now it's the Undersecretary for the Office of National Coordinator. So they've raised it up even in the federal government. So that's the organization that governs all the electronic health records that are certified in the country.
And I think certainly in the US, there's been a lot of activity, hasn't there, around kind of, some of these safety implications, data governance activities in the context of AI. A testament to the reception to your presentation. We've got lots of questions. I'm just conferring with EMIC to see if we've got a bit more time. But I know this is so important to the EMIC community, so I am going to ask this one. I know some people feel diagnosis helps them enormously. How does this help or support people who may feel that getting a diagnosis is completely stigmatizing?
Yeah, so, with folks, you don't have to have a diagnosis, right? A diagnosis is something we use as clinicians to sort of peg how we treat a client. So you don't have to diagnose someone. What I didn't show is you don't need to look at the diagnosis. I can just show you the symptoms, right? What's important to me as a clinician is, what symptoms am I dealing with regardless of your diagnosis? So you have symptoms. I want to help you resolve those symptoms. The earlier I find out what those symptoms are, the earlier I can try to help you deal with the situation. So it is stigmatizing to some people to have that diagnosis. But if you look beyond that or before that, and you look at the symptoms and target towards symptoms, you don't really need to diagnose somebody. And I think that's how people can feel more comfortable.
Thank you, Mike. So we are very nearly at time. First and foremost, thank you so much to you both. As I said, it's testament to the quality of your presentation that we do have so many questions coming through. For those who have asked questions that we haven't been able to get back and answer, we will follow up. The EMIC team will follow up. For a few words from me, when Mike and Ravi and I met earlier in the week and we discussed this, what really struck me was the power of that wider picture beyond that 20-minute consult or whatever the time is in your particular area, and what that means in terms of allowing people to have a more biased or psychosocial approach that takes into account those different factors that influence a person's health and well-being. That was already really impressive. But I think then when you take into account the benefits to the workforce in terms of being able to support how they work in an environment that has become increasingly challenging, I think there's a significant potential indeed. So with that in mind, thank you so much. AI, as ever, generates lots of conversations, but I think your tool, as you describe it, has generated a lot of questions. Thank you very, very much for your time. Thank you for the very insightful presentations. I know that the audience has really enjoyed it, so thank you. And to everybody for joining us today, thank you so much. We can't wait to see you at our future webinars and hopefully continue some of the themes and discussions that have come out of today's session. Thanks, and see you again next time.